Hi, everyone. I want to welcome you to MedPsych. I am Mohab Hanna. I'm actually the founder of MedPsych Associates, and I'm a psychiatrist by training. I primarily focus on kids and teenagers and college kids, but I want to talk to you about what it is we do. In our opinion, as a practice, we believe that putting someone on medications is a huge deal. It's not something we take lightly. And it's something that requires a very thorough, deliberate process. And the reason we say that is that the idea of putting your son or your daughter on medications or you yourself going on medications is a huge deal. I think sometimes we lose sight of that as providers, and sometimes I think a lot of people in the culture lose sight of that. This is something we think very seriously about. And it's not something that is done in a hasty manner or in a manner of just asking a few questions for 20 to 30 minutes and just putting someone on a medication. That's just not how we do things. Our goal is to be very thoughtful. Our goal is to be very patient. Our goal is to be very conservative. Our goal is actually, believe it or not, to not use medications unless we absolutely have to. So part of doing a psychiatric evaluation with our practice is not so you can go on medications or put your son or daughter on medications. It is a diagnostic process for us to figure out what is going on. What is the problem in the first place? And how did we arrive at this point? Why does this problem exist? Is it a psychiatric issue where you should consider a trial of medicine? Or there's a lot of stuff going on here and that we need to begin to peel the onion. We need to begin to go step by step of addressing certain things before we rush into putting someone on medications. And I want to just be clear that this is especially true if you're talking about kids and teenagers. Putting a child or a teenager on medication is a huge deal. And I want you to believe it's a huge deal. And I want you to realize it's a huge deal. The fact of the matter is these medications have real side effects. These side effects are real and they can mess things up, and they can mess things up long term. So this is not something that you just do. It needs to be thought through. This is why we like to do a thorough psychiatric evaluation as a launching point of what we do. Sometimes there is a true, genuine indication to use a medicine, but even when we do it then, we always want to do it extremely low and slow and extremely conservative. The fact of the matter is these medications need a tremendous amount of monitoring. Things can go seriously wrong in medication. I'm saying that up front. I want to be honest with you and let you know that things can go seriously wrong in medications, and they require a tremendous amount of monitoring. If done correctly, if done conservatively, and if done with the right kind of monitoring, that's what it means to prescribe safely. Safety is our priority, and doing no harm. We want to help your children to do well. We want to help your teenagers and your college kids and you to do well. And we take that very seriously. And so as a result, we do a thorough evaluation. We like to think through what are alternatives, what are other things that can be done. So I just wanted to make sure you realize that this is what we're about. We don't think people should just go on medications without thoughtfulness and without a diagnostic process that requires patience at times. Hope that's helpful, and that gives you a little bit of an insight into what we do. Thank you.